think that constant fatigue is just you getting older? That shortness of breath is just being out of shape? You might be mistaken. It might be your kidneys screaming for help. Hi, I'm Dr. Marcus Holliday, a clinical nutrition specialist. Today, we're revealing the 12 silent signs of kidney failure. And the final one is the most dangerous and deceptive of all, because everyone, maybe even some doctors, dismisses it as something completely normal. Now, it's crucial to understand. Having a single symptom from this list doesn't mean you have kidney failure. The power lies in seeing the whole picture. But if you start to notice a constellation of these signs appearing together, that's when concern must turn into action. So, let's begin our countdown. We'll start with a sign that often gets mistaken for stress or just being a picky eater, a subtle shift in one of life's greatest pleasures. This brings us to sign number 12, the silent hunger killer. Picture your favorite meal, the one that always brings you comfort and joy. Now, imagine looking at it and feeling nothing, or worse, a wave of nausea. This isn't about being a picky eater. This is your body sending a signal. Here's the internal issue. When your kidneys fail, a toxic substance called urea builds up in your bloodstream. This poison doesn't just affect your digestive system. It directly attacks the appetite center in your brain, switching off your desire for food. But a loss of appetite is just the beginning of your body's signals. Sign number 11, the taste of toxins. You take a sip of water to quench your thirst, but instead of refreshment, you get a shocking metallic taste, like you're licking a coin. Your loved ones might notice a faint chemical smell on your breath, similar to ammonia. This is because you are literally tasting and breathing out the waste your kidneys are struggling to filter. The urea in your blood breaks down into ammonia in your saliva, creating this deeply unpleasant sign. And while what you can taste is concerning, what happens when you sleep is a critical clue. Sign number 10, the sleep thief. Darkness falls, the world goes quiet, but for you, the battle has just begun. You're exhausted all day, yet when you lie down, sleep is your enemy. You might jolt awake gasping for air, or feel an irresistible, maddening urge to move your legs. This isn't just anxiety or a bad night's sleep. This is the uremic environment disrupting your brain's sleep-wake cycle and the toxic buildup triggering a neurological storm that steals the rest you desperately need. Sign number 9, the electrical storm. In the dead of night, you're woken by a sudden, searing pain, a lightning bolt of a cramp that seizes your calf or foot. These aren't mild cramps from dehydration. They are violent, involuntary contractions that can be excruciating. This is a sign your body's internal chemistry is in chaos. Healthy kidneys meticulously balance electrolytes like calcium and phosphorus. When they fail, calcium levels drop and phosphorus levels rise, making your nerves and muscles hyperexcitable, firing off random, painful signals. So, we've seen how kidney failure can poison your appetite, steal your sleep, and send electrical storms through your muscles. These are the internal whispers. Now, we move to the signs that start to appear on the surface, the ones that become impossible to ignore. Sign number 8, the itch from within. Imagine an itch that isn't on your skin, but under it. A deep, maddening itch that scratching can't relieve because it feels like it's coming from your very bones. This isn't just dry skin. It's a condition called uremic pruritus. The cause? When phosphorus builds up in your blood, it can bind with calcium, forming tiny, needle-like crystals that deposit in your skin and nerves, causing this relentless internal torture. Sign number 7. The cognitive cloud. You're in the middle of an important conversation, and suddenly, the word you're looking for vanishes. You walk into a room with purpose, only to stand there, lost, the reason evaporated from your mind. This isn't just a senior moment. It's a toxic fog clouding your brain, caused by a double attack: an oxygen-starved brain from kidney-induced anemia, and the direct impairment from toxins crossing the blood-brain barrier. Sign number 6. The fluid overload. Your once comfortable shoes now feel like instruments of torture. Your wedding ring refuses to come off your finger. When you press a thumb into your ankle, the indentation stays for a few seconds. This visible swelling, known as edema, is a physical sign that your body is drowning. Your kidneys can no longer remove excess sodium, and water always follows sodium. Worse, they are leaking a vital protein called albumin, which acts like a dam holding fluid inside your blood vessels. Without it, fluid seeps out into your tissues. Do you see the pattern now? Your body is fighting a leak of fluid into your tissues and a leak of vital protein into your urine. And this critical piece of evidence is what sets the stage for why our number 1 sign is the ultimate master of disguise. Sign number 5. The first leak. You wake up, look in the mirror, and notice persistent puffiness around your eyes. You might blame a lack of sleep, but this can be one of the earliest and most specific signs of kidney damage, as the delicate tissues around the eyes are the first to betray even a small protein leak. Sign number 4. The protein alarm. Look before you flush. If your urine is consistently foamy, almost like scrambled egg whites, and requires multiple flushes to clear, you are seeing direct evidence of filter damage. That foam is the precious protein that should be in your blood, not in the toilet. Sign number 3. The ultimate red flag. Healthy urine is pale yellow. If you see urine the color of tea, cola, or tinged with pink or red, this isn't a subtle hint. It's a fire alarm. It means your kidneys' filters are so damaged they are allowing red blood cells to escape. It is a sign of severe injury. Sign number 2. The vicious cycle. Suddenly, your blood pressure readings are stubbornly high, even if you've never had a problem before. This isn't just a cardiovascular issue. It's a dangerous dance where your kidneys and heart are trapped in a destructive loop. Kidney disease raises blood pressure, and high blood pressure, in turn, accelerates kidney destruction. And now for the number 1 sign, the one we promised, the master of disguise that sends millions of people down the wrong path while their kidneys struggle in silence until a crisis hits. Sign number 1. The master of disguise. You find yourself gasping for air after climbing a short flight of stairs. A brief walk leaves you breathless. Millions of people and their doctors immediately blame the heart or the lungs, but very often the true culprit is the kidneys. This is the most dangerous sign for 2 critical reasons. First, severe anemia. Remember how failing kidneys don't produce enough EPO? This leads to a severe shortage of oxygen-carrying red blood cells. Your body is starving for oxygen, and your lungs are desperately working overtime trying to solve a problem they can't fix. Second, and more urgently, fluid in the lungs. This is the advanced stage of the fluid overload we discussed. When the body can no longer handle the excess fluid, it backs up into your lungs. This makes you feel like you are slowly drowning. It is the #1 most missed sign because it so effectively points the blame elsewhere, allowing the kidneys to fail in the shadows. I know this list can be alarming, but knowledge is not meant to create fear. It's meant to inspire action. Let's turn that concern into a concrete plan. If you recognize yourself or a loved one in these signs, here is your immediate action plan. Step 1. Schedule the appointment. Do not wait. Call your doctor and be direct about your concerns. Do not allow your symptoms to be dismissed as just part of aging. Step 2. Use the right words. When you speak to your doctor, say this: "I am concerned about my kidney health and would like 2 simple tests: a blood test to check my GFR and a urine test for my ACR." Step 3. Understand your risk. Your risk for kidney disease is drastically higher if you have diabetes, high blood pressure, heart disease, or a family history of kidney failure. If this is you, you must be your own biggest advocate. Your kidneys work silently. It's time you listened loudly. If this video has provided you with value, please share it. You could be putting life-saving information in front of someone who desperately needs it. Like and subscribe for more health knowledge that can protect you and your loved ones. Take this information, take control, and take action. Your future may depend on it.